Well, if you've got reoccurring tension headaches, the source of the pain could be traced to your teeth. That's right. Dr. Jeffrey Hoos from Brush and Floss Dental Center in Stratford is back to talk about the connection between headaches and dentistry. Well, welcome back, Dr.
Hey,
Hoos.
thanks so much for having me back. It's great.
So there is such a thing, dental-related headaches.
I really want to be very clear about this.
Okay.
We're talking about dental-related headaches, not headaches you have to go and see the general physician for,
Okay.
the neurologist for, the ENT guy for. We're talking about dental-related headaches, teeth-related headaches.
Okay, and you talked with me earlier about the fact that sometimes people who clench their teeth are the ones that kind of experience these headaches, right?
Right, exactly. I mean, you have to figure out what's happening to your teeth. We've got to stop you from clenching. I mean, I have my good friend here, Al.
Al, yeah, this would be Al, everybody.
This is Al, and Al has been nice enough to show up. Say hello, Al. Hello, Al.
It's only Dr. Hoos.
So when we turn Al to the side and we see that Al has these big muscles on the side of his head, it's called a temporalis muscle.
Right.
Well, poor Al, he's been waking up every single morning with this terrible headache.
You know what? Let's take that picture if we can, because I want you to walk us through what happens actually in the head and how that kind of corresponds with the teeth. What are we looking at, Dr.
Well, what we
Hoos?
can see there on the top, it says headache between the two yellow arrows.
Right.
That is the headache area caused by the clench of this muscle. And below that, on the left-hand side, it says joint pain damage. That's caused by the clenching. And so what happens is we have face and sinus pain. Sometimes the patient goes to the ENT, the ear, nose, and throat doctor,
Right.
and they say, I'm having sinus pain, and the ear, nose, and throat doctor smartly says, this isn't about your sinus, this is about your teeth. You need to go see your dentist.
So is that TMD?
That's temporomandibular dysfunction. Unfortunately, some people say, I have TMJ. Well, you know what? We've both got TMJs up here. Everyone has two TMJs.
Okay.
What we're talking about is muscle, temporomandibular dysfunction of the muscle.
So what's happening is all that clenching is adding pressure?
Exactly. Well, you know, how are you feeling in the morning?
Well, you know, Dr. Hoos, I am a clencher. I am an admitted clencher at night, everybody.
You're a clencher at night. So let's you know, everyone at home, take your hands, put it up beside the side of your head, and clench your teeth together.
Okay.
Clench, 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 clench,
Right.
clench. So now we're going to take this clean glove, open your mouth slightly, and just gently close.
Okay.
And now, Desiree, are you able to clench your teeth together? So therefore, open your mouth.
Okay.
Therefore, if we stop that clench, we're going to take away your headaches. I mean, poor Al. What's happened is he's got these muscles on the side of his head.
Right.
Clench, clench, clench. I mean, here, if we think about it, let's take this tie and let's wrap it around Al's head.
Okay.
All right? And he's squeezing, 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 and he's doing that all night long.
Right.
What happens? He wakes up with a terrible headache. So now what we've made, Al, is we've made this little device called an NTI.
And it's this right here, right,
Right,
Dr.
it's
Hoos?
this NTI.
Now, for all the admitted clenchers and grinders at night, you're telling me that this little NTI is going to keep us from doing that?
Well, if you look to the side here, what's happening is that NTI is keeping Al's teeth apart in the back.
Okay.
Now, here's the big controversy. Many dentists want to put a night guard that goes between people's back teeth.
Right.
What happens is you end up breaking that night guard, cracking that night guard. My philosophy, based on the teachings of a guy named Jim Boyd, who was a dentist in California, who was suffering from these terrible tension headaches, he invented this device called the NTI. And so now, Al can't get his teeth together in the back, he can't clench, his headaches are starting to disappear.
You want to be like a garage door is what you said.
That's exactly right. We've got that garage door image here that what happens, we see on the left-hand side of the garage, we've got this big weight. That big weight acts sort of like a canine tooth, the big eye tooth.
Right.
And that eye tooth doesn't allow the jaw to open up carefully from side to side. And so where the red arrow is, that represents that big muscle on the side of a person's face.
That's really cool.
And you know what happens? The muscle becomes sore. The muscle goes into spasm. And when the muscle goes into spasm,
Right.
from up here, sometimes people get neck pain and back pain. And so we ask them, are you clenching your teeth at night? I am. Are you waking up in the morning feeling comfortable? No, I'm not. If we stop the clench, we're going to win.
So let's take the final picture, because I want you to show our viewers at home that are watching and in the office what it actually happens when you're asleep. That's what it's going to look like, right, Doc?
That's a little device, as I said, invented by Dr. Jim Boyd in California. That device fits on your front teeth. Sometimes we do top ones, sometimes we do bottom ones. It depends on the diagnosis. And that diagnosis allows us to stop the clenching.
Okay, bottom line, let's talk about how soon after, if we were to get this, how soon after will we see a relief?
So you have to come into the office. You got to do a diagnosis. You've got to figure out actually what muscles are clenching and what muscles are overworking.
Yeah.
So now we're able to make the device in the office. So you can leave with it.
Oh.
So now you have to wear it for 2 weeks. And over the next 2 weeks, we see a change in the symptoms 80% of the time.
Unreal. I love that. All right, everybody, if you want to get in touch with Dr. Hoos at Brush and Floss Dental Center in Stratford, the information is on our screen, or just come to our website, WTNH.com. Click on Connecticut Style, and we'll hook you up with our Connecticut Style dental expert, Dr. Hoos. Thank you so much.
Stop that clench.
Okay, I'm stopping the clench. I'm coming to see you for one of these really soon. All right, everybody, stick around. Coming up next, it is a sensational singing chef. It's Neil Fuentes. He's back in the kitchen when Connecticut Style returns, so don't go anywhere.